Well, if it's okay with you all, why don't we get started with our press conference this morning. I'm Dr. Ted Wymyslo. I'm Director of the Ohio Department of Health, commonly called ODH in these circles. And thank you for joining me today as we talk about a collective release of information that we have from several reports that analyze the statewide Smoke-Free Workplace Act. While 58% of Ohio voters approved the Smoke-Free Workplace Act, which bans smoking in public places and places of employment in Ohio, some also voiced concern about the economic impact that the new law would have on local businesses. No doubt you've heard much about that in the press. That's why we started to look at data and trends to examine not only the health impact and behavioral impact of this law, but also to look at the economic impact. Earlier this year, ODH and our public health partners looked at 5 sources of data to determine the health impact of this law. ODH also conducted an analysis of attitudes and behaviors of Ohio adults related to this law, and a member of OSU's College of Public Health was contracted to look at the economic data. While it's important to note that these studies only represent initial findings on the impact of the law, I think you'll be very interested in the findings that we have to date. Additional studies are currently underway, but the reports we will discuss today show that the statewide Smoke-Free Workplace Act is having a positive impact on the health of Ohio residents. Several of our staff members at ODH decided to use the reporting database usually utilized to track health events, and that's our Ohio epicenter system that we have. And so they look for things like outbreaks, pandemic influenza, seasonal illnesses, and we track how those are happening in emergency departments. And we wanted to see if we could identify any trends after the Smoke-Free Workplace Act was put into place. William Storm, Brandy Bennett, and Brian Fowler compared emergency department visits for symptoms consistent with heart attacks both before and after enactment of this act. They found emergency department visits for these symptoms related to heart attacks declined by about 26% after the enactment of this act. So we were surprised it was that dramatic. And because of this, that led ODH staff and our partners to examine additional data sources to confirm and further explore these initial findings. That initial chief complaint data study is what it was called, led our next author to conduct his report. I'd like to introduce to you David Bruckman. Mr. Bruckman works both for the Cleveland Department of Public Health and the Case Western Reserve University. He looked at ODH obtained aggregated discharge data. So remember before we looked at just the complaints patients came in with, and now we moved to discharge data from the Ohio Hospital Association to calculate the age-adjusted rates of discharge for heart attacks. Across hospitals in Ohio, this was done from 2005 to 2009, and here he is to tell you what he found. Well,
good morning. As Dr. Wymyslo said, we obtained statewide data that reflected discharge data for AMIs, for heart attacks, across Ohioans for 2005 and 2009. And we were interested in seeing if the May 2007 indicator was significant in looking at these trends of hospitalization and discharge rates. Now this is important because many other state reports have looked at and have actually found an association between lower rates of heart attacks and asthma and an association to an enacted smoking ban. So I wanted to introduce this chart to you. This chart actually shows heart attack hospital discharges for males in Ohio. Notice the points here on the chart. And our first exploration was to do what's called a time series analysis.
Yeah, any way so you can point that out?
And this time series analysis really is very robust. It uses a lot of the information in the source, and we were really interested to see if this May 2007 date was in fact significant part of the modeling. And in fact, what we found was that there's really a significant drop all the way going to September in rates. And within this model, we found that the rates continue to drop through 2008 and 2009. We used a second method called cubic splines to verify this, but without noting that there was a May or June or July or September effect. And in fact, we found that independent of placing any month indicator in our model, we actually found that June 2007 was a significant factor where the rates changed from slowly decreasing, then flattening out, and then taking a very, very strong. So between the two, we were very happy. We were very pleased that we found at least some indication that the two methods verified that there was a strong effect in lower discharge rates between May and June.
Very good. Thank you. Well, next, it's my pleasure to introduce Elizabeth Klein. And so, as opposed to some of our health-related data here, which is good news to all of us that are clinicians, Dr. Klein, working at the Ohio State University School of Public Health, looked at taxable sales of Ohio bars and restaurants. She's well versed in this type of work and has done a similar economic analysis recently for the state of Minnesota. Dr. Klein.
Morning. So, as Dr. Wymyslo said, the purpose of our analysis was to evaluate whether the Ohio Smoke-Free Workplace Act was associated with any changes in the economic health of bars and restaurants in Ohio. So we used monthly data that was reported to the Ohio Department of Taxation in the form of taxable sales or tax liability. So that's the amount of money owed in sales taxes. And we selected only those businesses that were most likely to be licensed to sell alcohol for on-sale consumption, for on-site consumption. And so that was really businesses that are considered bars or drinking places or full-service restaurants. And we evaluated those business types separately. So if you take a look at the chart over here, we have the taxable sales data over the period of time that we studied. Now this is unadjusted data, but this represents the sales trends for these businesses types, and we looked at them separately. So then we conducted an interrupted time series analysis to be able to compare for changes in sales for the time period before and after the Ohio Smoke-Free Workplace Act, and then we controlled for underlying economic trends as well as seasons of the year. So what our results indicated was that there was no statistically significant change in sales that was associated with the Ohio Smoke-Free Workplace Act. That was for either bars or restaurants. And these findings are consistent with studies that have been conducted in cities, counties, states, and countries where there were no significant economic effects that were associated with policies that restricted smoking in these workplaces.
Well, thank you. Now we're going to change gears slightly again, and the next report I'd like to tell you about was done by one of the Ohio Department of Health's own Brandy Bennett. And so, for those of you who aren't familiar with it, we used for this the information from the Ohio Behavioral Risk Factor Surveillance System, which we call BRFSS, because that's so many words to say. And this is a telephone-based survey that's the primary source of Ohio-specific information, and it looks at diseases, injuries, and health risk behaviors across the state of Ohio for residents who are 18 years old and older. The Ohio BRFSS includes the adult tobacco survey, so this is embedded in that process, which assesses behaviors and attitudes regarding tobacco use. Ms. Bennett used 2009 data for this study, and from this analyzed questions related to smoke-free policies. She found that, like the 58% of Ohioans you remember who supported the law in 2006, the majority of adults in Ohio still do not believe smoking should be allowed in indoor work areas or in the indoor dining areas of restaurants. In fact, nearly 74% of respondents do not believe smoking should be allowed at all in indoor work areas. In addition, about 75% of the respondents in the survey do not believe smoking should be allowed at all in the indoor dining areas of restaurants. Then I'll focus on the last graphic that we have on the end there. This was a different question that was asked, and according to this BRFSS survey again, 73% of adults, which are the first two graphs you'll see on the left side of that display, either strongly approve or approve of the Smoke-Free Workplace Act that we have in place. Additionally, 8% of Ohioans neither approve nor disapprove, and that's the next bar that you see on there. 11% disapprove, and 8% strongly disapprove. Interestingly, if you look at the first two areas of graph there, even non-smokers, 40% of them either strongly agree or agree with our current Smoke-Free Workplace Act decision that was made. So I think we're starting to see an evolution even in the smokers, and the support is stronger than I had anticipated it